Welcome back to Wave Listings Live. Joining me now is Dr. Regan Ackerman from Freedom Mini Dental Implants. Dr. Ackerman, pleasure to have you back on Listings Live.
Thank you so much.
We love recurring guests here,
Always
especially ones that bring stuff for us to show.
Yeah.
And you always do that. So you do a lot of stuff to help people get their smile back, specifically these small diameter implants that are less invasive than some of the more traditional surgical ones that you see across there. And it is something too that when you're working on this, you kind of have to have a passion for it. You want to be able to help people. You want to be able to help people get their smile back. And that's what you've done in your business. It's a family business. You treat everyone that comes to the door like family. Just talk about how you operate and why that goes into each and every person that comes to the door.
Yeah, 100%. So we are a small office. I'm the only dentist there. So, you know, you're not going to get lost in the shuffle. My husband works with me. He's the one that takes the x-ray. We do free consultations, so it's no charge. So if you think, you know, you might be want to see if you're a candidate for the mini implant, please call the office. It's a free consultation. And, you know, I help so many people in, you know, different ways with the mini dental implants. It could be replacing a single tooth with them, or all your teeth, or snapping dentures. And you're talking about how rewarding this is. Actually, this week I had a patient come in. He had dentures for many years, and I was able to do kind of permanent teeth on him. He got rid of the dentures, nothing on the roof of his mouth, and he came in for a follow-up appointment, and he wanted to say, you know, I almost just called the office to tell you this, but you have changed my life. Like, I can eat whatever I want now. I can taste my food, and this has been life-changing for me. So, you know, super rewarding, and that's why I do what I do, and why I'm so blessed that I discovered the mini dental implants to help people. A lot of people were told they're not a candidate for surgical implants, or maybe they can't afford them, and a lot of times I'm able to help people. So please call the office and see if you're a candidate. It's a free consultation.
Yeah, and you really are affected by your smile each and every day, because, you know, maybe it's not how it should be, but, you know, first impressions matter, and that 100%. Kind of stuff. When you're like timid and you're afraid to, you know, show your smile because you don't like it, it could change how you live your life. But yes, you have the examples here, so I want to you talk about the less invasive, the small diameter. This example here really shows just how big that difference is.
Speaks volumes. Yeah, a lot of patients come in and, you know, they're not familiar maybe with what I do, and I show them this model and they're like, wow, okay, that makes sense to me. A lot of the surgical implants, they have to make an incision and make this big hole that you see here. I do not have to do that, so I do not have to have as much bone. So I'm going to cover this up because that is not what I do. This tiny little hole here that's hard to even see, so that is the hole I have to make when I place a mini dental implant. So as you can see, I do not have to have as much bone. Kind of we say I just have to have some bone. And I do not do sedation, just local anesthetic. So many of my patients drive themselves to the office, drive themselves home. I'm not making any incisions or stitches. I don't have to take people off blood thinners to place these. I'm just making, you know, a little pilot hole essentially through the gum into the bone, and then I'm able to place, it's just a smaller diameter, a one-piece diameter implant, and you don't have to wait like another 3 to 6 months to use it. For the snap-in dentures, the day I put your implants in, you leave with the dentures snapped in. But I think this model just shows how less invasive the mini dental implant
We've got
is.
all three examples of what you do here, the third of which we have good examples of before and after pictures.
Correct.
So why don't you real quickly go through the first two, and then we'll talk about the third.
Okay, great. So I'll start off because a lot of people are just missing one tooth, or maybe, you know, a chewer in the back, or multiple teeth. So, you know, if you're missing just one tooth in the front here, maybe you have a flipper or a partial that you hate wearing, I can definitely help with that. You know, I place the mini dental implant. The day I put it in, you're going to leave with a temporary. You don't have to wait 6 months to a year to restore it. You'll come back about 4 weeks later, and we'll have your nice, pretty, permanent tooth, and we will cement that on permanently. And I had one patient tell me it's like she grew her tooth back, and I thought that was a great way to say it. And like I said, you don't have to do just one tooth. It could be multiple teeth. So we just do a bridge where the teeth are splinted together, and then they get cemented on permanently.
And I think the snap-in dentures are pretty self-explanatory, but at least show them what it looks like.
Definitely. Well, this is a game changer for people. So many people are struggling with dentures, especially that lower denture, but I will place the mini dental implants, you know, no incisions or stitches, and then the same day I will put the attachments inside your denture. You leave with that denture snapped on to the implants. So no more denture glue, no more wobbly denture. You wear it 24/7, snap it out once a day, rinse and clean everything, and snap it back in.
And I do want to at least get to the first example that we have to show of this third example, which is the permanent teeth. So let's take a look at that one. Show us what that is, and if we've got time, we'll come back and show the model.
So she was struggling, couldn't wear dentures, so we did the permanent teeth for her. We're going to show that, but it's just a bridge of teeth. There's nothing on the roof of her mouth. She can taste all her food, and she doesn't have to take anything in and out every day. She brushes those just like regular teeth, uses a water pick, can eat steak and salads and all the good things she wants to eat.
And you got one more example of this. We'll show that real quick too.
Okay,
I know, just because we already said we were going to show her, and I want to show the difference.
Pictures are worth 1,000 words. So yeah, she had to have all her teeth removed, and we did the permanent teeth on her as well. And she is just a wonderful personality and deserves to have that smile.
About 30 seconds. Show us what those permanent teeth look like here.
Yeah, certainly. So placing the implants the same way, just placing more implants. So no incisions, no stitches, no sedation, and then we make a bridge of teeth, and then that gets cemented on permanently onto those implants. And then you have nothing on the roof of your mouth, taste all your food, brush them just like regular teeth, and we give you a water pick to use.
Yeah, and the appearance is one thing, but having that ability to just feel like it's not there changes a lot of stuff too.
Security of having your teeth either cemented in or snapped in is a game changer for people.
Freedom Mini Dental Implants. Visit them at freedomimplants.com. You can call the number on your screen as well, 937-4930. Dr. Ackerman, thanks again for joining us on Listens Live.
Thank you so much.